Tragic events over the past few years have brought a wave of attention to the subject of mental health in America.
Are we doing enough to treat it, or are we turning a blind eye on it? Hi, I'm James Green.
And I'm Sherry Green. Mental illness can affect anyone from a small child to the elderly. Understanding the scope of mental health problems and treatment is the first step toward success.
So for the month of May, we are focusing our volunteer spotlight on mental health.
Mental health has been a topic we've discussed a lot here on this show. And for the entire month of May, we're using our volunteer spotlight segments to shed some light on this very important issue. Please welcome this week's guest, Matt Roberts from the Mental Health Association of Greater Dallas, and my good friend and amazing man, Rudy Gatlin. I can figure that Matt is here representing mental health, but you're here because you're a patient.
And if you don't have patience, you will soon be one.
That's right.
Yes.
So tell me about this, Matt. Tell me about the entire month.
May's Mental Health Month is a very important month because it raises awareness of mental health issues, which are very common health issues. They're no-fault illnesses, and they're very common. 1 in 4 families are affected by a mental illness, and up to 1 in 17 people have a severe and persistent mental illness.
All right, let me ask you, mental health now, are we talking about brain injuries? Are we talking about depression? Or what does it encompass?
When we talk about mental health, we're talking about diseases like depression, schizophrenia, bipolar disorder, your anxiety disorders, post-traumatic stress disorder. Those are issues that happen within the brain that are really nobody's fault, but they can affect either mood or thought.
And Rudy, you said something earlier, and that's really why you're here. You said there's one more.
Well, throw a little alcohol and drugs on top of that.
That addiction, then, is a mental health
It's exceedingly
issue.
common. Up to half of folks with a mental illness also have a co-occurring problem with drugs and alcohol.
So,
I had a drug problem. I ran out. Thank you. Thank you very much. Boy, when you're a drug addict and you run out of drugs, you've got a problem.
It's bad.
Yes. That mental obsession. I mean, think about it.
But what was driving the obsession for drugs?
It made me feel good.
I know, but what was making you feel bad that you needed drugs to make you feel better?
Nothing.
Nothing was going on.
Not in my life, not a darn thing. I had had the cars, the planes, the celebrity, the status, the hit records, all that. I loved the way it made me feel, and I had time to do it and money to do it. So
how did it make you feel?
Wonderful.
Okay. All right.
I don't kid with people.
No, I know, and
especially
I'm not
kids.
kidding with you.
I mean, when I do my little talk, I say, it makes you feel wonderful, and you want to do it again. We're creatures we like to feel good. So that's what we do.
And life was not enough to make you feel that good.
It was, but why not feel better? And then pretty soon, it kind of backfires on you. And that's then the mental obsession takes over. Physical abnormality and a mental obsession.
What kind of mental obsession?
You're going to go do it, and you know you're going to feel bad afterwards.
Were you risking everything to have it?
I
Yes,
risk
you
my
were.
health.
Yeah,
But you can risk
how
your
about
career.
relationships, family?
They didn't know. We
They
hid it.
didn't know?
We hid it. Unlike today, we hid it real well. I did. Yeah. So, didn't let them know.
And that's a challenge. Folks don't talk about either their behavioral health illnesses, their mental health illnesses, and as a result, folks don't know that treatment is available. They don't know that recovery is out there. So that's why it's important to have these kind of conversations so folks can realize that treatment is out there, treatment works, and recovery is possible.
One of the things that bothers me is that there are so many commercials for depression curing medicines that I've always heard that depression was anger turned inward, that there's somebody we're mad at that we can't quite come to terms with. It rings true with me. And I don't think there's a cure in a medical sense. It can mask it, you can cope better, but I don't think you ever get rid of it till you forgive whoever you're mad at, which gets you on a road beyond the world of medicine.
Mental illnesses are so complex. There's many factors that go into the illnesses that folks have, and there's many ways to recovery. And what you're talking about, sort of insight, looking inward, getting counseling, getting help that way, that's a real vital part.
And it is a part, isn't it?
Until then, I've got a little pill here for you. I want you to take 2 of these. Call me in the morning.
But of course, medications are effective.
Right. There's that physical,
Yes,
chemical, you know, the serotonins and all that stuff, not quite getting together. You've got serotonins that are right there.
So do
And
you think
the medicine
yours
helps
was a
connect.
disease?
Yes.
It was a disease. And
Absolutely.
so you're now drug-free.
Absolutely. Yes. I haven't had a drink in 28 years.
Oh my gosh, Rudy.
Well, I couldn't have done it without the drugs, but
You
that's
stop.
another joke.
Oh, listen,
Yes.
this man has a very serious
It's good to
side to him. You know,
good to laugh at.
and let me tell you something. Humor is a way to get away from intimacy. So we don't want to get too close here. You know what I'm saying, you nutcase?
But we're going to.
Okay. You can get more information on the Mental Health Association of Greater Dallas by going to mhadallas.org. I love you, Rudy
I love you
Gatlin,
too,
and I
Susie.
love to hear you sing.
A publication in the UK claims that even though mental health has lately been at the forefront of media coverage, the subject is still effectively ignored worldwide.
So join us every Monday during the broadcast as we learn more about mental health and what we can do to treat it. For the Volunteer Spotlight, I'm James Green.
And I'm Sherry Green. We'll see you next week.